Okay, there we go.
Sorry,
Yeah, so welcome, John. Thank you very much for coming to the steering group, and it's much appreciated. So over to you.
Thank you. I was actually going to start with a reference to the 20th anniversary. I hadn't seen the open the agenda to see it was on there already, but yes, it was a year in which it did very much look like the acceleration of the privatisation programme was going to be even more dramatic than it turned out to be. And we had just in that 2005 period, we had United Health taking over several GP practices, kicking off in Derbyshire, in the Derbyshire coalfields, and then into Camden and central London. Fortunately, none of those lasted the pace. Actually, during 2005, we also had Virgin taking over GP practices and reaching a higher percentage of GP practices than Centene recently did. But again, that would prove to be a phase, and some of those things that we were very concerned about then proved not to be carried through in the way that we feared they would be. So it was an interesting period, but clearly at that point we had the new Labour government was still very much backed by the trade unions. Very much, it was very difficult to motivate opposition in the mainstream at all, and Comp was pretty much a huddling together of those of us that saw the dangers of what was being proposed and attempting to build a concerted response. It's interesting. We also 2005 was the period in which they tried to bring in the complete reorganisation of the primary care trusts, hiving off the community services at that point, many of them to social enterprises, and the whole notion of world-class commissioning, a complete, almost unintelligible load of nonsense that was produced about how it was absolutely vital for each area to cultivate its own market, competitive market in healthcare. So it really was quite a high point in that whole period, and the government having set a target for the proportion of NHS elective care that they wanted to be carried out by the private sector. Again, fortunately, they didn't reach that target, and I don't think it's been reached yet, but it certainly was a warning sign. And now, of course, after all those years and fighting things, and in some cases, the things proving impossible for the government to actually carry through. In other cases, we've been winning some partial victories and some more substantial ones in the process. Now it's deja vu all over again, and we've got actually worse than Blair and Brown in the sense that we've got a government that's been elected with a sweeping majority. They've got 5 years, they can do almost anything they want. And it turns out they had got no plans, no ambition, and no real intention to make any of the changes that a number of people thought they were going to get when they voted Labour in the election. So it's extremely worrying. We've got austerity back again. The budget has turned out to be insufficient. Sorry, my mouth is dry. I'm going to take a drink. We've got the budget barely sufficient to pay the increased pay bill for next year, the budget increase that was given by Rachel Reeves. We've got, as we've added up from the Lowdown, we've got 8 billion of cuts targeted by the various ICBs across the country. If you add up their so-called savings targets, that's 8 billion. No details at all as to how those cuts are being made, but clearly we're in a situation where everywhere the financial pressure is being felt at the same time as we've got this demand that Tony mentioned, the crisis at A&E, the pressures that are growing on A&E, and the problems of the whole system continually silting up with the failure to develop any coherent services, social care, community health care, develop primary care to actually sustain patients once they've been discharged from hospital. So we've got 12,500 hospital beds, 1 in 8 hospital beds, more or less permanently filled with long stay patients who really should have been sent home and looked after elsewhere, but can't be because there is no such system in place. And what has Labour done? Well, after all this talk about what they wanted to do and they wanted to change, we've just got a whole series of things put off. We've had the planning proposals for the next financial year put off. instead of being published as normal before Christmas. We've got the emergency service plan, which apparently Streeting is developing, again put off, not yet announced, in the middle of the emergency care crisis. We've got the 10-year plan being postponed, pushed back to the summer, and some undisclosed date in the future. We've got the talks with the unions. They're supposed to look at how to revive the pay structure, the Agenda for Change pay structure, given that Band 2 is now just a few pence above the minimum wage, whereas Band 1 was comfortably above the minimum wage when it was brought in. So serious discussions need to happen, again put off until the late summer or the end of the year, and again all the possibilities of that. The whole inquiry into, much needed inquiry into the use of physician associates, etc. Finally, Streeting announced an inquiry way after it should have been called, and we're now in a situation where the legislation is brought in, the GMC has taken over, so supposed regulation of PAs, and a crisis is raging, and the government's actually got nothing to say on the question other than simply sitting back and watching it. And of course, we got the government deciding again not to intervene at all to prevent outsourcing of services. We've seen obviously the Colchester dispute, where they're outsourcing services that were brought back in-house back in 2011 and 12. And again, the government refusing to step in there. And we got, of course, the Bath, Swindon and Wiltshire £1.3 billion contract going out to this private equity funded outfit, aiming to produce big profits within a couple of years of taking over a contract. And again, the government sat on its hands, despite the promise of the biggest wave of insourcing the world has ever seen. So we're in that situation. And of course, they're actually, in some senses, making things worse again, because we've got the national insurance contribution increases that are set to cost a fortune for GP practices, for hospices, and for care homes and the privatized care sector, which again are going to create the probability of cutbacks and both in the quality and the quantity of the care that's actually available. So we've got a real situation backed up now by, of course, the quademic, the RSV plus COVID plus flu plus norovirus. That's actually massively piling pressure onto the frontline hospitals. You've got the ambulances once again queuing out of the car parks of the hospitals. Massive delays in A&E, massive trolley waits for people who need emergency admission, and setting new records all the time, despite the fact that this has been warned about repeatedly, in particular by the Royal College of Emergency Medicine, who I think have played a really sterling role in fighting right through the Tory government, and now again under the new government, for this crucial area of the NHS to be taken seriously. All of it was predictable. All of it's been predicted. And what we had was Wes Streeting talking to Labour Party members saying, oh, there's going to be a bit of a bumpy ride over the winter. But of course, it's all down to what the Tories did. And the Tories left it underfunded. And now 6 months in, Labour has done nothing whatsoever to relieve that pressure or give any hope it will be relieved in the next period either. We've got costs rising on ICBs, but the ICB budget's clearly unable to cope with them. How are they supposed to deal with some of the questions that are really driving the costs up? We've got continuing care costs, which for the frail elderly and for people with mental health problems, continuing care costs, which are driven by the private sector, are rising and causing problems in many areas. We've got mental health placements, out of area mental health placements in the private sector. Again, sky high costs. Again, what else are they supposed to do other than pay, since there's no capital or facility to expand the NHS to take care of the rising numbers of people with very severe mental health problems? We've got the rising drug costs. Are we supposed to stop prescribing drugs to patients that need them? How else are they going to cope with those rising costs? And we've got the bills from the bank and agency and overtime working of staff to cover the fact that the vacancies in the frontline services that are under this pressure. And again, it's hard to see how that's an avoidable cost. So if they're not going to cut those, they're going to have to cut back on other areas. And there again, we can see the pressure on the ICBs. But what we can't see is what the ICBs are actually deciding to do, because more and more these decisions are being taken quite clearly in private session of the ICBs and not in the public board meetings. And I think there is a real question here about accountability and transparency that I do think campaigners need to start to consistently raise. I know some have been valiantly doing so, but I do think we need this as a central focus, because it's extremely hard to fight cuts and closures, and some of the measures are being put forward if we don't know what they are, and they're being decided behind closed doors, and they're not surfacing until in some cases they've already happened. So I do think we've got to be looking at some kind of campaigning pressure around that. We've got the backlog maintenance, again, 14 billion. It's doubled since 2019, more than doubled since 2019. And again, no sign whatsoever of any government willingness to take this question up. We've got 43 trusts now have maintenance bills well over 100 million pounds each. And we've got many more with again, nowhere near getting any relief. And of course, this limits the use of the buildings that are actually there, and it limits, therefore, the numbers of patients that can be treated, and it creates safety concerns as well. And the Starmer plan, of course, ignores all of this, absolutely all of it. There's a big speech on Monday focused entirely on elective care. And why is that? Because, of course, they're focused mainly on finding ways to get the private sector involved. The private sector doesn't do any emergency work. It's not interested in the actual frontline pressures on the NHS. The private sector is only interested in picking up a greater share of elective work. And that's why the whole thing is skewed completely away from where the sharpest and most severe problems actually are. And he picks up where the Tories left off. So we've got all this focus on these community diagnostic centres. 203 apparently are now either in operation or planned. According to the private sector, 13 of these are privately run. 20 more are substantially private. And then there's another undisclosed number in which they're using private sector mobile scanning units as part of the running of these centres. Now, the problem with these CDCs is that they fragment the workforce further. Every CDC needs, as a minimum, X-ray staff, radiographers to take the images, and radiologists to read the images that are taken for the MRI, the CT scans, etc., the X-rays, and so on. They need those staff. There's desperate shortages of those staff. And if you go and start a new range of CDCs doing this on a small scale, you take them away from the frontline hospitals doing all the other work on a large scale. And that's what the Society of Radiographers and the Royal College of Radiologists are actually pointed out. There's a real big problem here that actually build more of these so-called local accessible units. You actually reduce the access to the main centres where the treatment's actually being delivered. Now, NHS figures show that the NHS itself has expanded its diagnostic services by 30% over the last 5 years to 30 million a year. Diagnostic tests carried out by the NHS. The private sector is carrying out in the region of, I think it's 750,000 of those tests, and they're being asked to increase the numbers of episodes in which combine outpatients and diagnostic tests and inpatient treatment, apparently by 1 million cases a year. Now, we don't really know exactly how that's supposed to work, because clearly it took 5 years to increase the NHS provision by 30%. How long it would take the private sector to expand by 20%, we don't actually quite know, and there's no real details. How much is it going to cost? The Guardian speculates that if they go up, which is effectively it's a 20% increase in the numbers, overall numbers of private patients treated in one form or another by the NHS, but paid for by the NHS, from 5 million, an extra million going on. But the Guardian estimates if they put another 20% on, then it's going to be 20% more spending, and work it out from the total spending in the last financial year and say it's an extra £2.5 billion. Now, if you spend an extra £2.5 billion treating 1 million patients, that comes out 2.5 grand per patient. And since 2/3 of it at least is outpatient treatment, which costs nowhere near £2.5 grand, you've got to really wonder about the costing of all this and what it really would cost. And if that's anywhere near a correct estimate, of course, all that money is flowing away from NHS trusts that have it at the moment, out of a budget that's already fixed and going into the coffers of the private sector. Now, this is going to be a massive financial blow to the NHS trusts. It's a major, major issue for the NHS trusts. Quite apart from the value for money, quite apart from any ideological questions about how you think about this, this is actually a ridiculous way to proceed. Not least because it's much more sensible to expand the units that actually already deliver the bulk of the services, rather than build new units that treat handfuls of patients relatively and try and expand and get the growth through them. It's just an absolutely ridiculous way forward. I think it's important to recognise the agreement that's been signed with the private sector. And I'll just look at some of the headings in a moment. I see there's been a lot of discussion of this on the comp colleagues, but it's a pig in a poke. Don't know what you're getting for the money. There's no costings at all of what any of the individual things are going to cost. There's no timescale as to when it's going to be delivered. There's no statistics on what the benchmarks are we're starting from and what we're going to get to. There's no concrete details about any of the schemes that are going to be delivered. And there's just one focus, which is to get the private sector in at all costs into the act and into the money. Now, this is not a way to actually set about improving elective care, even if we were to assume that elective care was the only issue that the government had to pay attention to. And the new agreement is just a real piece of work. It talks about aligning digital systems to ensure that patients are effectively steered as wherever possible towards private sector providers rather than the NHS. It talks about longer term contractual relationships. Well, this is building towards a permanent dependence of the NHS on a large scale use of the private sector. It talks about NHS private sector taking on the training of NHS staff, which of course has always been impossible because it's a completely atypical training environment. You're only dealing with only the most minor cases and relatively few of them compared to the actual caseload that comes through the doors of any normal NHS hospital. It's almost impossible to give proper training to doctors and to nursing staff under those conditions. They say there has to be no impact on the level of NHS provision and the staffing of the NHS. Again, that's impossible. There's one pool of staff that has to be drawn from. And the NHS has trained most of them and brought most of the other ones into the country. And if you start building up the private sector, you start losing from the NHS. So there's no way this will not have an impact. They talk about bringing the NHS, the private sector, into the ICB planning, specifically reversing what the Tories agreed to do, which was to say the ICBs would not have private sector representation on them. And again, this is a really serious way in which this is actually worse than what the Tories actually were bringing forward a bit beforehand in the 2022 Act. And they say it's going to be additional to NHS provision. But again, we know that this has been questioned again and again, last time by the Parliamentary Public Accounts Committee, drew serious questions about the extent to which any expansion of the private sector would be additional rather than simply displacing NHS work into the private sector. And they talk again about the whole deal being to facilitate long-term investment in the provision of private sector resources to treat NHS patients. This is like PFI without any assets coming out of the other end. PFI was bad enough, but at least at the end, we're going to get hospitals that will be owned by the NHS. This actually is paying the private sector to invest in itself, guaranteeing the private sector will be a crucial part of the NHS provision for the indefinite future. This is a really wretched deal in every way possible. And certainly I think that this is something we will have to campaign about, but it's become very difficult to build public awareness of it because you have so many things to explain before an ordinary member of the public can really understand what's going on. And it's so vague, it's so general, that it's very difficult to build a local campaign about it as well. So I do think this is, we have to find ways in which we can see local examples of this actually working through, and we can actually build a focus on them. And just finally, this is the underlying question. We need more information in order to build the local campaigns that really have been so effective in the past. Been local campaigns around national issues that have really taken and scored hits and delivered successes. And I'm just ending on this now. And sorry, there's an echo coming back.
John's been muted.
Yeah, 20 years on, 20 years on, it's still Comp that has to take the lead in fighting for this. And I wish everybody a happy new year of fighting against a whole new series of really worrying issues. And if you don't do it, who else is going to do it? Thanks very much.